Hello, this is Drew Lynch, and I will be discussing the PulsePoint app, its purpose, utility and usability, possible legal and ethical issues, and the app's overall benefits. The purpose of PulsePoint is to increase the survival rate for victims of sudden cardiac arrest, SCA, by initializing the chain of survival rapidly and effectively to increase survivability and decrease mortality rates. The chain of survival consists of a series of specific events that must occur in rapid succession in order to increase the victim's chances of survival. The links that construct the chain of survival consist of early recognition of SCA, activation of 911 emergency response system, early cardiopulmonary resuscitation, CPR, use of automated external defibrillator, AED, advanced life support care provided by EMS, and finally, post-resuscitation care that is continued by healthcare professionals in the hospital setting. Local citizens can help save lives by quickly addressing the first four links in the chain of survival with help from the PulsePoint Respond app. PulsePoint is designed to empower healthcare professionals and public citizens by alerting nearby individuals that someone needs CPR and providing them with GPS-guided directions to the victim's location and the location of the nearest AED that can be used to help save victims in cardiac arrest. This app can be utilized by EMS agencies, nurses, and other healthcare professionals who work together to implement PulsePoint and connect their community. Emergency room nurses and physicians can utilize this app to show active emergency calls and see if a major traffic accident may soon cause the ER to be overwhelmed with patients. This allows nursing staff to get adequately prepared for an influx of patients from mass casualty incidents. The application's opening display shows the locations of almost every active emergency 911 call around the entire county, as well as traffic accidents and previously reported medical emergencies so users can avoid these areas. The display itself is easy to use via touch-sensitive inputs with scroll and zoom buttons available. When a 911 call is placed and help is needed, emergency dispatchers send a notification page to local EMS first responders and nearby users of PulsePoint simultaneously. A CPR needed notification immediately pops up on the user's preferred computer, smartphone, or tablet device. If the user acknowledges the notification, GPS navigation leads the nearby citizen to the victim's location. Pictures of nearby AEDs, including location and navigation, are also provided to the PulsePoint user. Users can tap on the medical emergency pin to view more information about the call, such as EMS and first responders that are dispatched to provide further care. The most difficult legal issue would be getting EMS agencies, local hospitals, and county officials together and partner with each other to integrate PulsePoint into the emergency dispatch and healthcare system of local communities. Only then can users get full access to the app. Users who agree to use PulsePoint Respond will have their phone's location stored, but no movement activity will be monitored. Patient privacy is kept intact because PulsePoint users are only notified if the patient is in a public location. Potential rescuers are protected by the Good Samaritan law, which dictates that individuals who respond and provide help to someone in need cannot be held liable for injuries caused, as long as the individual has good intentions. There are numerous benefits to this application. PulsePoint helps prepare emergency room nursing staff for the potential arrival of multiple patients. It also helps EMS first responders by alerting CPR-trained citizens and assist them in providing life-saving care to fellow citizens. The PulsePoint app features CPR and AED tutorials along with a metronome to ensure users provide high-quality CPR at the appropriate compression rate. Patient privacy and HIPAA remain intact because private information is never given out, and notifications are only sent if the victim's location is public. This app truly is a lifesaver. In conclusion, evidence shows that people are getting older and getting sicker. The chain of survival is stronger when communities come together to help fellow citizens in need. EMS, first responders, and firefighters rely on the citizens of local communities to help save lives and perform simple, life-saving techniques and begin the chain of survival as soon as possible to maximize the chance of survival in cardiac arrest victims. According to statistics gathered by PulsePoint researchers, 57% of adults indicate they are trained in CPR techniques, with the majority indicating they would provide aid during an emergency, but only about 11% report using CPR in a real-life situation. PulsePoint changes that by bringing communities together and empowering them to help each other during a life-threatening crisis. It is imperative that communities spread the word about this incredible app so when the time comes for changing the emergency response system, the governing officials can be encouraged to implement PulsePoint. Thank you for listening.